Good day once again. I am Julliene Kaye Bigsang from BSN 12A. Okay, so we're done with the essential newborn care as well as the female or the perennial flushing. So now we're down with the female urinary catheterization. So catheterization is an insertion of a catheter into a patient's bladder, and it is used as a conduit to drain urine from the bladder into an attached bag, or what we call the urinary bag. Okay, so let us start. The first thing that we need to do is, of course, to check for the doctor's order so that we will not commit any mistakes. Okay. Okay, so after checking the doctor's order, we will now prepare the equipment that we will be using. So prior to this procedure, I have already prepared the catheterization set that I will need, so that I will no longer need to prepare it in front of the patient, because that might scare the patient or make the patient more nervous. Okay, so here we have our Foley catheter. We also have our urinary bag and of course our catheterization set. And then after that, don't forget to perform proper hand hygiene or proper hand washing technique so that we can prevent the spread of infections. Okay, so after doing the hand washing, now we will verify the client's information, and also it is important to explain to her the procedure that we will be doing. For this will lessen the tension that the patient may feel, and it will be easier for us to insert the catheter. And also it is important so that the client may feel less discomfort, and also it will lessen her anxiety. Okay, good morning po, ma'am. I am Julliene Kaye Bigsang, and I will be your student nurse for today. May I know what is your full name po?
Rain
And
Santos.
when is your birthday, ma'am?
June 18th,
Okay,
2000.
how would you like me to call you po?
Reg Nalon.
Okay, so Ma'am Rain, today we will do the urinary catheterization. So I will be inserting a catheter into your ureter po. So you may feel a little bit uncomfort, but in a little while, magiging okay na rin po. So just relax your body po so that mabilis po tayo matapos. And don't worry ma'am, because I will provide the privacy that you will need so that hindi po kayo mahiya if may mga makakakita sa inyo, kasi we will close the doors and the windows naman po. Is that okay with you, ma'am?
Unamen.
Okay po, thank you. After that, we will provide privacy for the client so we can put on screen, or we can close the doors and the windows for the client's privacy. So ma'am, I will now be closing the doors and the windows po. Okay, so after that, we will now positioning the patient in a dorsal recumbent position with her knees flexed. So this position is for the better visualization of the patient's meatus. And now we will drape the patient, and we will expose only the area that should be exposed. Okay, and then after that, we will now apply lights so that we can see better the patient's genital area, so that we can insert better the catheter and easier. Okay, so we will put it here. Okay, so we should open this carefully because this is a sterile item. And here, and here, and here. So in our set, we have here our sterile gloves. We also have our cotton ball soaked in a solution. We have our kidney basin, our lubricant, and of course our forceps that we will use to cleanse the genital area of the patient. Okay, so now at this point, we will now be cleaning the genital area or the perineum of the patient. So we will use the cotton ball soaked in a solution. So we will just clean the inside, or the midline rather, of the patient. So we'll start from the mons pubis down to the patient's anus. Remember to not retrace a stroke so that we will not contaminate the area that is clean already. Okay, and then we will discard this here. Okay. And then after that, we will now be donning our sterile gloves. Okay, so we're done donning our sterile gloves, and now at this point, we will be placing the eye sheet on the genital area, or on the perineum. And then after that, we will now be lubricating our Foley catheter So lubricating our catheter reduces the friction. So we'll just lubricate 1.5 inch. Just be careful not to clog the opening of our catheter. Okay, and then after that, we will now be inserting our catheter into the patient's ureter. So we will use our index finger and our thumb. We will pull up the labia minora, and then we will insert the catheter for at least 2 to 3 inches or until the urine will flow. Okay. Slowly. Okay. And we will pinch it. So if a specimen is to be collected, we'll just pinch the catheter with our thumb and first finger, and we'll place the specimen container in position. And then after that, okay, we already connected the catheter in our urinary bag. Okay, so now we will just inflate the balloon. So as if it has sterile water inside. Okay, so slowly inflate it. Okay. And then after that, we will secure the indwelling catheter by taping it to the patient's thigh. We will be taping it on the patient's thigh. So allow some space for the patient's movement. Okay. Okay, so after that, we should place the patient comfortably, and we will now be doing the aftercare of the equipment. So first, let us remove the eye sheet. Okay. Then after that, we will now again drape the patient so that you can cover the area that should be exposed. Okay, like this. And now we'll do the aftercare of the equipment. Okay, so now we're done with the procedure. We have inserted the catheter in a patient, and we have draped the patient, and we have made the patient comfortable. Okay, so after that, we'll be doing the aftercare of equipment, and after that, we will record and document our procedure that we have done to the patient for future references.